Okay, yeah, someone else will start now. If you want to start the stream. Yep. Hello, everyone. My name's Shurajit Dutta. Welcome to the webinar here today. I'll be joined by my colleague Ty as well. So we'll be presenting on the ICD-11 cause of death application that's within DHIS2. I'll just go over how we'll handle the session. So we'll break up the session into two parts. So I'll start the session. I'll go through some of the more user-facing features. So we have kind of the data entry part, the analysis, etc. I'll cover that. Then we'll break for Q&A. So that should take about 45 minutes, maybe an hour, let's see, depending on the time. And then I'll hand it over to my colleague Ty, and he'll go over the installation and configuration. Now, we're not going to go into all the detail necessarily. We do have documentation resources, etc., that you can follow up on in order to figure that out. But I do suggest that if you are more interested in the kind of technical details, then you reach out to us. We have contact details as well as the resources that will allow you to do that, especially if you're having trouble setting things up later on. All right, so we'll spend a little less time on that and a bit more time just kind of going through the app and walking through its feature set. All right, so I'll get started on the first part here. And yeah, between both, we'll have some time for questions. You can post your questions in the chat. I probably won't see them until the break though, however, okay? But then I will have a look at them when we do take a break. All right, so let's just start with a little bit of background on the application itself. So the whole idea around developing this cause of death app was to kind of address the challenge that was identified regarding standardization of collection of this data. So it's been identified for some time now that the collection of cause of death data is challenging in a lot of locations. We don't get the necessarily full context of the death situation in many countries. They are either unable to report, they have significant challenges reporting, or there's just a lot of missed deaths for various reasons. So as a result, there's a lot of kind of incomplete death data in many of the locations that DHIS2 is implemented in, as well as other countries as well. But the app looks to address at least the issue of collecting data in a standardized fashion. And we work closely with a number of stakeholders and partners on this in order to address this situation. So we've been working on the app roughly since 2021, on and off. I don't think it was as serious until the last maybe year and a half or so, though, where we really kind of ramped up our changes, etc. So, but we have been having discussions in particular about how this works for some time. And this is a joint collaboration, actually, between HISP Vietnam and the University of Oslo. So the HISP Vietnam team has been providing a lot of their technical expertise in developing this application. And the University of Oslo has kind of in the last little while also been supporting, in particular, a lot of the implementation guidance, as well as development on the app, in particular, Ty, who's here on the call as well and part of the HISP-UIO team. So we've developed the cause of death app, and it's undergone several iterations. Since then, WHO has released a DOORS coding tool that you can go to. You can have a look online. It really helped us shape how the cause of death app should work. So with the DOORS coding tool, you can enter in your causes of death. It'll give you a lot of feedback. It'll tell you how it got to its conclusion. In selecting the underlying cause of death, it will let you browse the dictionary, etc. And this was a kind of big pushing point for us, as it provided a lot of structure around how we should also develop the application itself. So since that was released, it was a great help to us. And consulting with WHO, we were able to make a lot of revisions based on that. We've also worked with a number of countries that have kind of beta tested the application, I would say. They're not really using a production level system yet, but they've been providing great feedback to us. So Ghana, Solomon Islands, and several other countries that have been using it to kind of test with their own data and provide us feedback. And we've made sure to implement that feedback in this version of the app. That being said, the app is still a work in progress. What I mean by that is we're going to go through the feature set. I'm going to demonstrate it. I'm going to show you how it works. And there might be something missing that you notice. Please don't be alarmed by that. There are still a lot of different use cases and workflows and different features that we know are required for the app. That being said, we think it's in a really strong place, really robust place right now, and be ready to be used by the community. But there are updates planned for that, and we will talk about that towards the end of the session. Okay, so before I go over the app, I'll just give a bit of a background regarding what some of the key features are, and then I'll get into a demo and go over the application itself. Okay, so the app itself is something that you install on your DHIS2 system. And like I mentioned, Ty is going to go over just in some quick detail about the installation process. So the nice thing about the application is that it works in a number of situations. So if you already are using DHIS2 Tracker, it will nicely integrate with your existing configuration. So for example, if you have a system with Tracker metadata and you have various details such as names, IDs, etc., you can use or reuse all of that information in the ICD-11 mortality application. On the other hand, if you don't have a tracker system, if you don't have anything, it'll just set everything up for you from scratch, and it'll do that very quickly. So it's a quite easy configuration. You don't really need to be what I would consider a DHIS2 expert in any means. You just need to know some basics, and you can install the app pretty easily. It allows for a simplified and standardized data entry, I should say, as it uses the medical certificate of cause of death, so the WHO medical certificate of cause of death, as its baseline for collecting the death details and death data. And then it follows ICD guidelines for filling that certificate in and all the logic that's associated with filling the certificate in. It allows for real-time data capture or secondary data capture, whichever one you prefer, as you can enter data at the source if you prefer, or you can enter data retrospectively if that's how you're currently doing things as well. The app also allows you to browse the entire ICD-11 dictionary. So within the app itself, there's a connector to a service provided by WHO, and this allows you to browse the entire ICD-11 dictionary within the application itself. So you don't need to leave the app, you don't need to go to a different WHO tool. WHO is providing a service that allows external apps to connect to it and display the ICD-11 browser or dictionary directly in the apps that are connecting to it, and I'll show that as well. We also use a digital mortality rule engine. So on top of connecting to the dictionary, we also are able to use a service provided by WHO to classify or select the underlying cause of death based on the various causes that you've entered in your medical certificate of cause of death form. So this is something that we would promote, I think, quite a bit, as all of the various rules and logic that's incorporated with selecting the underlying cause of death has been incorporated into this engine, and it's quite accurate in terms of selecting the cause of death. And we'll demonstrate a couple use cases for this, where maybe in other situations, the underlying cause would be incorrectly selected. However, it's selected correctly as a result of using this rule engine. There's also a number of analytics that are associated with the application. So we have a number of custom dashboards that are built into the application. We also have the ability to export to Anacod and perform that analysis, and I'll show that as well today. We can also generate a cause of death certificate, and what we're really emphasizing is that how we've placed this certificate is much more a medical certificate of cause of death. We know there's also a legal certificate, for example, provided by civil registry or home affairs or some type of department within your country that entitles a person for various legal benefits. That's not necessarily what we're talking about producing, though of course you can share the data from the ICD-11 mortality app with your civil registration unit, but the certificate we're producing is much more for medical data. We'll show some examples of this so you get a better picture of what we're talking about. And as I mentioned already, yeah, we allow for Anacod analysis. I'll show that. We also offer full translation support. So we have a custom translation interface. We've tried to make things a little bit easier. The app is self-contained. There's not necessarily a ton of characters to translate. So we've made a little interface that allows you to translate this quickly, or even just translate the app in Excel, in an Excel sheet, basically. And I'll show that. We have the automatic grouping of the underlying causes of death by chapters and various other cause groups that allow for various analysis, as you'll see, both directly in DHIS2, on the regular DHIS2 toolset, within the custom dashboards that have been built, as well as within Anacod that is used in a lot of places to analyze this cause of death data. We also allow for the use of unique identifiers. So as I mentioned, if you have tracker systems already, you can use existing identifiers to identify these people. If you don't, you can of course incorporate any new identifiers that you want to associate with this program. There's also various user-based access controls. So various features within the application are kind of controlled or cordoned off by these user controls. So for example, there's different modules within the app, and those are accessible based on which user permissions you have. There are various functions in the app, like deleting records, things like that, that might be a bit more sensitive. You can control who has the authority to access and perform those operations. And Ty will actually talk a little bit more about that than myself. Okay. All right, so let's get into the demo itself. So what I've done, we'll share this slide deck after the webinar here. I will post it and we'll make sure you have access to it. So there's a bunch of slides that basically go through the features that I'm going to talk about now. Now, rather than go through the slide deck, I've just given them for your reference so you can have a look at them later on. But I'm actually going to demonstrate these features instead so you can see them live. But just keep in mind that I'll share this with you in case you want to refer to it later on or use it for any other purposes going forward. Okay. So open that here. Okay, so let's go to the cause of death application. So it's an application that you install in your DHIS2 system. And then it's here, it's called ICD-11 cause of death. So I'll just open that up. So it's a self-contained web application. For those of you who aren't familiar with the app ecosystem within DHIS2, you can install additional apps on top of DHIS2 to extend its functionality. So in this case, even though, so what we are working with is a DHIS2 tracker program for those of you who are familiar with that. But instead of going to something like Capture, we're going directly to this ICD-11 cause of death application. Many of the elements, for those of you who are familiar with Capture, are borrowed from that application. So you will see a lot of kind of similarities between the two in terms of selecting an organization unit or kind of working with the program itself. But it's self-contained because of the way we access the services provided by WHO. So that's the ICD-11 browser, that's the underlying mortality rule engine, and other such services that help us code the certificates. So let's just start by selecting or showing some data here. Okay. So for those of you familiar with Capture, there's not a lot of differences at the moment. You're just selecting an organization unit. It'll then display your front page list for you here. So we have this list that we see right now. It'll display the records on the front page that you see. These details that are at the top, these are modifiable. So these are based on the program that you have. And you can select which ones appear in this front page list by modifying them in the DHIS2 maintenance application. And those will appear here. This ending column here on status, this shows if the record has been completed or not. So it offers a little bit of follow-up, though we know there is some improvement there regarding kind of maybe a working list functionality, etc. But we'll talk about that maybe later on. Okay. So if you want to open a record, you just select the record, open it up, and this is what the interface looks like. And we're going to go over this in a lot more detail. You'll see the medical certificate of cause of death on the right side of the screen here, the demographic details on the left side, and an output as well. Okay, so we're going to walk through all this in a moment. Another kind of key feature of this before I get into registering a new record and walking through the data entry process is the ability to search. So if I go to search here, there's two options for searching. Okay, one is a person in the program. This is just going to search for a person within the ICD-11 cause of death program. So maybe you start entering some details, you don't have everything, you need to come back and reopen their record. You can do that. The other is selecting a person from another program. And this is kind of one of the key features that we see being used with this cause of death app. Let's say someone is receiving HIV or TB or NCD care in another tracker program that you have in DHIS2, you are able to take the person from that program and then enroll them into the cause of death program if they pass away for any reason, right? So you can use those existing people in your system and register them in the cause of death program without having to enter all their demographic details in over again. Okay, so let's just demonstrate this real quick. So what I can do, I can just search by an ID. I'll just show you. So based on the program you have, so right now I'm searching within the cause of death program. In this cause of death program, I just have one unique ID. Now, if I had more than one, these different unique IDs would appear. I could search via any, let's say I had a national ID or a social insurance number or a health card number, and I wanted to use one of those instead, then those different IDs would appear and you could search via those IDs. Okay. This other option here, if I just expand it, search by attributes, this just allows me to use any of the attributes, their name, their sex, their date of birth, etc., to search for an individual and find them in the system. Right. So I can start here. I'll just search for a person using the ID. I've used a unique ID, so it's only going to return one record. If I search by attributes and it's a kind of a search where there's maybe multiple people with the same name or some other details that kind of match, you will see a list of records. You'll see just some items here in the table, and then you'll see a view button. If I click on that, it'll take me to their record, open it up. I can see the page here. So this is the person I searched for with their ID, and then I found them. Okay. So the other method to search is for a person in another program. This varies a little bit from the Capture app. In the Capture app, you can narrow this down and select the program as well. But you can also do a system-wide search and search all of the programs in your system. The way this search is working, it is just searching all the programs in the system by default. So you don't need to select the program that the person is registered in. So this is an existing person that is registered in another tracker program, and they've passed away. I want to find them, and I want to enroll them in the cause of death program. Okay. Okay, so I can search for them. So in this case, you'll see the details, and then instead of view, you'll see the enroll button. Okay, so if I click on that, it will enroll them in the cause of death program. It'll take any details that are already there and bring them over into the program. And then I can continue with entering information on the certificate as needed. Okay. Okay, so let's just go through the process from the beginning. Let's register a new person and let's enter some details on the on the medical certificate of cause of death. Right? So we'll go to new registration. For those of you familiar with Tracker or Capture or anything like that, part of this process will be familiar to you. For those of you who are not, what we're doing first is we're taking the demographic details of that person, we're entering them in the system, we're going to save their demographic details so we can refer to this record later on. We can search for it as I showed before, or we can use their data in analysis for various purposes within DHIS2, in Anacod, etc. But the first step before we do anything is to actually just enter their demographic details along with the date that they've died and the date that you're reporting this information. So I'll just enter this real quick. So we can enter a report date. Let's say it's these dates here. We'll enter some name details for the person. And enter a date of birth. And you'll see the age gets calculated automatically based on the date of birth. Now, there are different units of the age, of course. So if you look at the medical certificate of cause of death, because you could have someone who's just a couple days old, you could have someone who's a couple months old, etc. So based on the time period that you've selected, it'll automatically calculate the units for you as well. Okay. We can enter the sex. So these options, of course, if you have more, for example, then you can modify these drop-down menus as well. Okay. And then you can enter some address details as well. Okay. So right now, all I see is this profile, and then I see this empty output box. On the right side, I don't see anything yet. Once I click on create, it's going to create that person in the system, and then it's going to load the medical certificate of cause of death on the right side here. Okay. So what we're seeing on the right side is the WHO medical certificate of cause of death. It includes all their standardized fields for the medical certificate. So if I scroll down, so we have the medical data here, surgery, manner of death. There's maternal deaths. This is just because I've selected female. If I select male, this won't appear. Okay. There's also a selection on, a section on infant deaths in that certificate, right? This is not an infant, so it doesn't appear, but it will appear if they're within a certain age. Okay. And these include all the standard fields within the WHO medical certificate of cause of death. And this might not match your country certificate, but we really encourage you to try to match at least the minimum fields that are here. So actually, when you install the application, we don't allow you to modify or remove any of these existing fields. Now, the reason we do that is because we are using WHO's automated rule engine to select the underlying cause of death. And in order to select and validate that cause of death, we're not just using data from the top part here, this medical data. We're actually using data from the entire certificate. So this includes, for example, details from the manner of death, the surgical details, etc. This will help you to select the proper underlying cause of death and also validate those causes of death. So that's why we don't allow you to change that during installation. So even if your certificate doesn't look like this, if you are thinking of using this application, it's a good idea to think of how you could align with this a little bit more. It doesn't mean you can't add other fields, because during the installation process or even later on, you're able to add your own sections. You can add more variables. So supplementing what's there within the WHO medical certificate of cause of death is perfectly fine, at least in terms of the configuration. You probably want to keep things minimal, not to confuse your users and your stakeholders using this. But at the same time, we do suggest using, to the extent possible, the standard certificate, because it takes into account all of these different fields when it's sending the data to the WHO service and when it's returning the underlying cause of death as well. Okay, so just to make sure that all the rules are followed, etc., it's better to have all these sections in, and therefore we don't allow for the removal of these sections. All right, so let's just go through and enter some data, and then go through the process of kind of getting our underlying cause of death for an individual. So on the left side for the medical data here, when I start entering text, I just have boxes for free text. So this could be whatever's entered on the paper certificate, let's say, and I can start here. So this is not going to bring up any menus or anything like that. I'm just entering in plain text, okay? And I'll enter in a sequence. Let's see, like this, okay? So beside each of these free text fields, on the left side here, I have this box ICD-11 coding tool. So I'll click on that and it'll bring up this box. This is the ICD-11 browser. At the moment, I don't see anything. And the reasoning behind that is we didn't want the entire ICD-11 dictionary to load upon first opening this tool. But once you start for searching and narrowing down the terms, then you'll see kind of how this works a little bit more. So okay, so you can see here I've entered a term, it starts searching, and it returns some information for me. Okay, so I have the ICD-11 code, I have the cause here, and then I have some information on details. I can add some additional filters, I can sort a little bit more as well. Okay, so if I wanted to, for example, see these details, I could see the matching terms, I could see the definition. If I wanted even more detail, I could see this in the hierarchy to get more information. So what you're seeing here is the full ICD-11 browser. You'll see I haven't left DHIS2. I'm still within DHIS2, and I can do this full search. So what we're doing here is we're connecting to the service provided by WHO, which is the full ICD-11 dictionary, and we're able to search various terms and use the full dictionary within the application itself. So if I wanted to select this as my first cause for cause A, I could select this. You'll see here my selection is, it gives me the ICD-11 code, and then it gives me the term as well. Okay, so I can click on OK here, and then I can see the ICD-11 code is added to the form. So if I hover over that, it'll give me the text associated with that code. All right, and I can just continue to fill in the remainder of the codes in the same way. So I'll just search. Okay, and same thing. So you can, if you kind of don't need to go through that whole process of checking the details or viewing the chapters, etc., you can just click on the cause that you want to use as your code. It'll appear here, and then you can click on OK, and then it will be added to your form. Okay, so we'll do it for the last one. Okay, and same thing, I can hover over any of those codes, and I will get the text associated with those codes. Okay, so I've filled in this first part here. What I'm going to do now is add in the times that are associated with these causes of death. So you continue, moving over more to the left side, or sorry, to the right side here. I can click on this time from onset to death button here. It'll pull up this pop-up. I can add in the units for the time interval, and then I can enter the interval. Okay. And you'll see when I do that, if I now hover over the code here, it gives me the time interval that's associated with this code. Okay. And we can do that for the remainder. Okay. So these little item in brackets, this is the time interval that's associated with the causes that I've selected. Okay. All right, so moving over a bit more, you'll see at the moment I can't manually select the underlying cause of death. We'll get into that in a second. Okay. If I scroll down, what I'm going to do is just fill in the rest of the details. So as I mentioned, we are using the full details from the entire form to select our underlying cause of death. So where you have this information filled in, we do suggest that you fill it in online as well. So I'll just fill in some of the fields, even though there's not much to fill in, let's say, in this particular case, since it's very straightforward. Okay. All right, so once I've filled in this information, okay, right now I don't have yet an underlying cause of death, but what I can do is I can get that by using this process button. So when I click on this button, what it'll do is going to take all the data that's within this medical certificate of cause of death form in DHIS2. It's going to send this to the WHO service, and then the service is going to return the underlying cause of death based on the data that I've selected and entered. Okay. So I'll click on process. Okay. And if I go over to the left side now, I have this output. So I have the ICD-11 code that it's selected for my underlying cause of death. This aligns with the respiratory tuberculosis code that I've selected. I have the underlying cause of death in plain text, and then I have the ICD-11 chapter as well. Underneath this, I then have some more information. This is a detailed explanation. This outlines how the tool arrived at selecting that underlying cause of death. In this case, it's just saying this is the last line. It causes the starting of the sequence, right? So this is due to this, etc., right? Just following the sequence on the form. This is a pretty straightforward case that I've entered in this particular scenario. All right. There's a lot more information that can be produced by the explanation and output box here. But just for starting, we can just kind of review what's here now. Okay. Okay, so before I kind of adjust this and modify this so we can go over some other examples, I just want to highlight a couple more features before we move on. Okay, so one very important thing to do, now that I've entered my data, I'm happy with what's been selected as my underlying cause of death. I want to make sure I save this record. Okay, so at the moment, this information that I've entered is not yet saved. The person is saved, but these details that I've entered, the medical data, surgical details, etc., are not yet saved. So this works very similar for those of you who are familiar with the Capture app, right? So in the Capture app, you now have to manually save your details. It's the same thing here. Okay, so make sure to do that before you close the record. If I try to close the record, it will give me a warning, right? So it'll tell me that the changes I made are not yet saved. So I want to make sure I save those. So just save that, give it a second. It'll give me a confirmation message that the details are saved. Now, just to show what I mean here, so this is saved now, right? If I remove something, close it, and then I go back to this record, you'll see that it's still there, right? Because it doesn't save any of the changes I make unless I click on this save button, okay? So just keep that in mind when you're using this application, that we do save records very similar, save data in a very similar fashion, as is the case with the Capture app. All right, so let's go through another quick example here. And what I'm going to do, I'm going to select kind of a incompatible cause of death here. So let's say for whatever reason I have selected the wrong code now. You'll see that the output gets reset as I've changed my selection. I've already filled in the rest of the certificate. So I'll just click on process here. Now it's going to return a cause of death, but it's going to give me now some extra information. It's going to give me a warning. Okay, in this case, I selected congenital tuberculosis as my code. Congenital tuberculosis, this happens in utero, right? So a child being born. This person is 45 years old. So as a result, this cause of death is incompatible with this person based on their age. So it's giving me a warning right away to correct this. And the idea behind this is, to try and reduce the amount of errors that are at the source, right? So we know there are often significant challenges with the quality of the cause of death data, and that auditing is a regular part of the process of reviewing the cause of death data. So kind of the idea is the more data that you can fix at the source, the better off that your data will be later on when you're checking the quality of that information. Of course, the person needs to be familiar a little bit with what this is saying and some of the rules, etc., that are involved with this. But WHO is basically using the entire logic available to them within this rule set to make sure to check everything and validate everything. Just to show this a little bit more, if I change this to accident as well, it's now going to give me a second warning that I selected accident, right? So I selected, that doesn't really align with what I've selected, right? Tuberculosis as the cause of death. And then I selected accident as the manner of death, right? So that doesn't align, and then the age also doesn't align. And as a result, it's giving me these different warning messages to say, hey, maybe you need to check this first. It doesn't seem to make sense based on the rules that we have, and you should correct these before we move on. So ideally, when you're working with this, you want to make sure that there's none of these warnings before you proceed to your kind of final closing of these cases, right? So I can just correct these. I can change this back and I can select the proper code. Okay, and I can run this again and you'll see here, it just gives me no more warnings because it's happy with what I've entered. Okay. So that's one way you can look at the data. There's a lot of other kind of validations and mechanisms that are used for validating the data. Just real quick. So that was based on age and the manner of death. For example, if I just remove things real quickly. Okay, so this is a male, and then I selected vaginal cancer as the cause A. If I process that, now it's going to give me a warning again, right? The sex is male, so this is inconsistent with the cause that I've entered, right? So there's a lot of different validation that is occurring behind the scenes with that rule engine, and it's very useful then to use the automated process as all these rules get incorporated when you're selecting that underlying cause of death. Just to show one more here. Okay. This last one here is not necessarily due to age, sex, or something else on the form, but what we see here is an implausible sequence of the causes of death, right? So the sequences are in the wrong order. So sometimes when someone's auditing your certificates or going through them, this is, something that they do find from time to time. Now, despite the causes being in the wrong order on the certificate, the proper underlying cause of death has still been selected. Okay, so that's because the rule engine that is provided by WHO is, it has some ideas of kind of what are typically the rules and logic that go into these certificates, and it's using that to determine the underlying cause of death. So in some scenarios, what you might just see is the bottom cause maybe being selected as it's the last one in the sequence, but in this case, the sequence is incorrect. And as a result, you have the correct cause of death being selected as your underlying cause. You can see here, this code here, 2B90Z is selected, even though the sequence is incorrect. So there are other types of rules and logic that are, typically the result of an audit after the fact, or that you're taught maybe as you're learning to code the certificate to follow those rules. Those are all incorporated within the rule engine. And it allows you to kind of be fairly accurate in selecting the underlying cause of death as we're using that service provided by WHO. Okay, so we've talked a little bit now about how this works in terms of selecting the underlying cause. Another feature, maybe not best practice here, um, but we've only seen kind of one cause per line. If you do have more than one cause on a line, you can in fact enter that the way it's supposed to. We know that's not best practice necessarily. We understand that, but this was a kind of requested requirement from a number of users in the field as well as some of our stakeholders. So even though it's not best practice, sometimes you're unable to alter your certificate at the time when you receive it. You receive it, it has more than one cause on a line, and you have to enter it the way it is. We do support that. So here I have my second um, cause, let's say. I can click on this box again. It'll open up the coding tool. I can search for my second cause here. Okay. And I can add that. So you can see here, I can have more than one cause on this line. Now, this is why the time is a pop-up, because if I select this now, I have two different causes, and I need to associate different time intervals with those two different causes of death that I've selected on that same line. Okay. So for example, here I can select units, and then I can enter in the interval for both of these causes. Okay. Now, what's interesting about this, if I go to process this, give it a second here. Oh, save first. Oh, sorry. Yeah, if I were to process this, it will still select the underlying cause of death. I'm in the wrong record now. I see. Apologies for that. But yeah, so you can have multiple causes on a single line, and you can still select the underlying cause. If I go, you can also select it manually. So let me just show this really quickly. Let me find that record again. Just show this with the other records since it's working. Okay, so I just want to cover the manual selection in case you want to manually select a cause of death at some point in time. So in this case, I've used the automated selection. And if you remember before, right at the moment, I still can't select any of these boxes. The way it works is you have to run the automated selection first, and then you can manually select the cause of death, okay? But you're not able to manually select the cause of death as the first process. Let's say whatever is on your certificate doesn't match what's been selected via the automated process, or you've already filed the certificate and you just want to keep it as it is, etc. So there are different reasons for this, we understand. But you are able to overwrite the automated selection, but you have to run it first because it might maybe give you some insight as to if your selection is correct as well. Okay, so in order to change to the manual selection, after I process the cause of death, I can go over here where it says underlying cause of death processed by, and I'll select manual. Okay, and now I can deselect this, and then I can select any of these items. Okay, so let's say I select this. Okay, now this is my underlying cause of death. You'll see here I get an output in terms of the code, the cause of death, and the chapter, but I don't get any explanation, right? The reason I don't get any explanation as to how that was selected is because that's a feature of the WHO service, right? When I send the data to the service, it will then give me an explanation of how it selected the underlying cause of death for me, right? But because I am selecting it manually, it doesn't necessarily know what logic I've used, and therefore it just gives me the output and saves that information, okay? But no explanation will be accompanied when you're using that manual selection. Now, when you use the manual selection, you also have to provide a reason. Now, we have a couple reasons here. These drop-down menus are modifiable, so you can always modify those and add your own reasons as well to this listing, okay? But let's say I can say that the medical officer did not agree, for example, okay? So just keep that in mind if you are kind of looking to do a manual selection, that it is possible. You have to run the automated process first, and then you can overwrite the automated selection. But you won't receive any explanation or any other validation as a result of using the manual method. So we'll switch back to yours actually. And what I want to do is change gears a little bit. So we focused a lot on the data entry so far. I'm just going to show a couple other features before we take a break here. So I mentioned in the presentation that you can also produce a certificate. So let me just open that up now. Okay, I'm just going to download this for me. Okay. Okay, here we go. So what we can do is create a certificate. And we can use a template. This is just an example, right? And it will automatically populate that template with the different details that you've entered inside of DHIS2. So we can see this is the name of the person, their sex, their date of birth, their date of death, and some other details here as well. Okay, so we have the causes, we have some of the other information that I've entered. So this is just a custom template that has been uploaded to DHIS2, and then you kind of map all of your details to that certificate. It will then allow you to automatically produce this certificate. And as I mentioned, this is what we're focusing on is being more of a medical document, right? The medical certificate of cause of death, not necessarily the legal certificate, right? Of death, for example, that's used for access to insurance or other types of legal reasons, right? But you can, of course, share all the data that's here or that's in DHIS2 with your civil registration unit, right? So this would allow you to make these certificates automatically. You could print them out, you could share them with the right person, etc., right? So we know that many countries have some type of certificate template that they already are working with. You can upload that, you can map all these details and make this automatically. Great. Okay, a couple other pieces of information here regarding deletion of the record. Okay, so this is a user-based control, right? So not everyone will have access to delete records. And if I click on this button, it gives me a couple options when I'm deleting the record. So the first option here, unenroll, this will unenroll the person from the program. So let's say you searched for a person in another program, maybe, you enrolled them in the cause of death program and you realized it's not the right person, you could unenroll them from this program and it will remove their enrollment and any of the data associated with that enrollment. You could also delete the person. If you delete the person, it's going to delete everything associated with that person. So if they're enrolled in HIV or TB or whatever other care or whatever other services, and they have data attached to that, that data will also be deleted. Now, there is a warning message. If I click on delete, it gives me another message to say that deleting this will delete everything basically associated with this person. So you can be very mindful, be careful here. But like I said, you get to control who has this authority. Not everyone will necessarily have this authority. It's up to you to decide who can actually access this part um, of the module. All right. Okay, so we've gone over the data entry in quite a bit of detail. I just wanted to show some of the features and show how it works with selecting the underlying cause of death. Let's shift gears a little bit and talk about the analysis side of things. So first, I'll go to ANACOD. And ANACOD is for the WHO analysis of cause of death tool, right? And what we can do here basically is when you have your causes entered, you can automatically produce a report with the ANACOD details. Okay, so I'm just going to let this run in the background. Okay, so this is ANACOD. For those of you not familiar with this tool, it is a very powerful tool for analyzing your cause of death data. This is a tool provided by WHO. There's both an online version and a desktop version. There's a lot of information on this tool. There's various webinars, there's various training materials and manuals, etc., that go over how to utilize this tool. For those of you who are familiar, maybe you've used it already. But I'm not going to necessarily give a great tutorial on how to use this. I just want to show how it works and how it integrates with DHIS2. So that file, I'm just going to let it run in the background. It takes a while to produce. I'll open it up in a moment. But I've created this file here. Well, let's see actually if it's done so I can show you. Yeah, here it is in the browser. Okay, so it's automatically produced this information based on the underlying cause of death for the various records in your system, along with their age and their sex. Okay, you can see that these first two rows are blank. This is the population data. We ask that you enter that manually and then upload this to ANACOD prior to your analysis, right? So it's just because we're not sure if everyone has the populations disaggregated in this fashion in every system. So you do have to kind of make that change before you upload it. Okay, and you can see here I've selected multiple years of data. You can select as many as you like, but it is pretty heavy to produce this. So, I would suggest maybe only doing it a year at a time if possible, but you can do more than 1 year if you really need to. So this is the CSV file. So you can see you can download it to Excel here. That's what I've done here. And I've just filled in the top two rows with some example population data. All right, so this is what it looks like in the Excel file. You have this country code, right? And it looks like it's kind of hard coded in, let's say. What happens is after you install the ICD-11 cause of death app, the first time that you open up the ANACOD export, it'll ask you to select the country, and then it'll add in the country area as well as the ISO code to this ANACOD export. Okay, so it just happens as part of the installation process. So I have my information here. This is what it looks like. You don't really need to interpret this whole Excel sheet here, but it's produced automatically from DHIS2. Then I can go here, I can upload it to this tool, just as a quick example. Now, I'm not going to go over all the information here, but just to show you it's working. Okay, so it'll upload the ANACOD file and then it'll produce a lot of outputs very quickly, right? So various statistics on your causes of death, age-specific mortality rates, etc. There's all kinds of analysis that this ANACOD tool produces. And I do suggest that if you're thinking of looking at the cause of death data, that you also incorporate some type of training or refresher training even on utilizing this app. Ask the various subject matter experts that you have access to. This is a very powerful and very useful tool for analyzing your cause of death data and provides a lot of useful details and information for you to use. Okay. Okay. So in addition to ANACOD, we also have built-in dashboards. Let me select a different year here. Okay. The built-in dashboards use the same type of data as ANACOD. So we're using the underlying cause of death, we're using the various cause groups, and we're using the age and the sex to disaggregate the deaths for a specific time period. Okay. So there are 9 built-in custom dashboards within the application itself. We have the mortality by broad causes. This is what you see here. So these are the broad causes split by category. You see the ages. There's some unique charts available. For example, this bubble chart. If I select one of the options, it'll break it out into various categorizations. So I can see the breakdown of my deaths in a little bit more detail. Okay. And I can close these, for example. We have the mortality by cause, age, and sex. This is a dynamic dashboard. So we have a number of causes on here, but I can add more. Okay, so I can add some additional charts. It'll add those to the bottom of my screen. Okay, and I can also remove those, and they'll remove in real time. Okay. We have mortalities from NCDs. So we have cancer here at the top, diabetes, cardiovascular disease, and respiratory diseases. They're just split by age and sex, as well as by time period. We have the most frequent causes of death as well. This is something you can also produce in DHIS2 directly. I'll talk about that in a moment. We have deaths by ICD-11 chapter. This is a visualization of this. You can also produce proportions or other types of visualizations as well by using the DHIS2 tool set. Then we have these different disease-specific dashboards. So from malaria, tuberculosis, AIDS, and then a combined dashboard for all three. These are broken up in the same way. So we have sex at the top, we have periods, and we have a bit more information at the bottom here. So all three of these dashboards are built the same way. And then we have a combined dashboard that combines malaria, AIDS, and TB into one dashboard. Okay. So I think the whole idea behind this is that we have Anacod, we have the built-in dashboards, and it's a good starting point for you to kind of get things moving. Because if you have existing data, all these kind of outputs are produced automatically based on that information, right? There's no manipulation or changes that you need to make in order to get these. There are the built-in DHIS2 tools, though, however, if you want to investigate the data a little bit more. So everything here is using the underlying cause of death, right? You have other details that you might be interested in, maybe causes A, B, C, D, other conditions contributing to the death. Maybe you want to look at the surgical details, the maternal death details, or infant death details. And those sections are not covered here in this custom dashboard. You can, however, so just as an example, this is the DHIS2 line listing app. I've just listed different cases with their underlying cause of death. I could, for example, add in causes A, B, C, and D to this so I can see the entire sequence for this person. I could add in the codes if I wanted to as well within this line listing app. There's a lot of different analysis you can perform, and you could place this directly on the DHIS2 dashboard, right? So everything I've been showing you has been within that application. And in order to access that, you need to open the application, go to the dashboards, or you need to have your Anacod file on hand and make sure you either open the desktop or the online version of Anacod and look at things there, okay? But you can produce, like for example, this one, this is the top 10 causes of death. This is produced both in Anacod as well as in the custom dashboard, but you could also produce it directly in the DHIS2 apps and place this on your dashboard. So a person who might not be necessarily accessing the app can just get a sense of what's happening really quickly directly on their DHIS2 dashboard. And there's all kinds of analysis that you can kind of perform within DHIS2, looking at all the data that you've captured. And this can include any sections that you decide to add to your certificate. So you might have some additional information that's required in your own setting that's not on the kind of standardized medical certificate of cause of death. And in that case, you can create all kinds of analytics around that and produce dashboards, built-in dashboards within DHIS2 using our built-in analysis tools in order to kind of get that information out. Okay. All right, so the last item that I'll go over before I take a break here is the translations. Okay, so we have a custom interface for translations. It's just row-based. It allows you to add whatever language you want to translate. It also allows you to easily kind of translate this stuff directly in an Excel file. So I could add a language here. I could use this interface to add a language. There's a full drop down here. I could search. I could just add whatever I want. Okay. It'll just add it as another column. And then I could continue with my translation. I could do it inside of the app itself, right? I could do it line by line in DHIS2 and save it. I can also export an Excel file, basically. So if I click on export, I can select one of the languages that I have added to my system. Okay, so let's say I select Spanish here. I can export that out. It's going to export an Excel file. Oh, sorry, I don't have Excel, do I? Okay, I have it open here. Yeah. Okay, and what's in that Excel file? We have the key inside of the app. The English translation is provided by default, and then you have a column here for your translation. So you could add the translations here in this Excel file, and then you could just import this back and upload it, and all your translations will be ready for you to use. Okay, so it's a fairly easy interface in order to work with these translations. And the idea was to kind of allow you to do that quickly. The way that is split up in the app is just by the different modules. So data entry, Anacod, dashboard, etc. The translation module even. So just to show you here, the way you access those translations is just the same way as you access translations in the rest of DHIS2. So if I change my languages to French, for example, and go back here, and I'll access the app again. Okay, so you'll start to see the translations here. It's in French, the menu's in French already. If I just open up a record maybe. Let's open up the one we added. Okay, and you'll see now the form is in French, the various buttons are in French, the various items are in French now, okay? So, and the output, etc. So the translation is pretty simple to manage. You can do it directly in the application, or you can do it directly in an Excel file, for example. Okay, so I've spoken for a fair amount. I think I'll pause here and we'll take a kind of brief pause and we'll maybe take any questions if there are any. You can feel free to raise your hand. I see there's a lot of activity in the chat. I'll have a look at that real briefly and see if there's any questions to address there. After we're done with these questions, I'm going to hand it over to my colleague Ty, and he's going to spend another 25 to 30 minutes just going over the installation process in a little bit more detail. Okay, so I'll just check the chat first. If there are any questions, please feel free to raise your hand or add them, and then we can go from here. Okay, so there are some specific questions about your own configuration, I think, I've noticed here. Yeah, in that case, maybe we can follow up with you afterwards to see exactly what's going on. I see there's some others trying to respond to those. Okay. I don't see any hands. Oh, I see one. Yeah, okay. Okay. Yes, please, please, Ahmad, please go ahead if you have a question.
Hey everyone,
Yes, hello.
good morning.
Yes.
My name is Dr. Ahmed Saidi. I'm Director General of Health Information in Ministry of Health. First of all, I would like to thank the team for excellent presentation and valuable content. I would like to briefly share our experience from Yemen. We have implemented the causes of death system in 20 referral hospital after preparing and officially approval the medical death certificate. During the implementation, we faced some challenge. First, the internet in Yemen is generally weak, which caused delay when searching for codes in the system. Second, we noticed the analysis function work only at the facility level. The analysis work only at the facility level, and we could not yet produce a report at the government or national level. Based on our experience, I would like to give two recommendations. The first, to assign member from HISP Vietnam team as direct technical support to the for the countries using this system at last for 1 year, especially as we are still in the trial phase. The second is to provide complete and update training materials for end users. So I it can serve as permanent reference for all countries using the system. This very important recommendation. Thank you again.
Yeah, thank you very much for those comments. Yep, we'll address the support at the end of the session. Also, we have updated materials, and I'll share those at the end of the session as well. So we have new documentation for users as well as for administrators, and I'll share that towards the end of the session. Thank you for those comments. So we'll go over that later on. Yeah, maybe Mohammed, I'll take one more question. I see some other questions here. Ty's been doing a lot of work responding to them. So, but yes, please, Mohammed, go ahead, and then we'll move on to let Ty speak. Oh, okay. I did want to address one question because I think it was important. Akash here asked about use of program rules in the application. So we know that right now it doesn't support program rules, right? There are some hard-coded rules for hiding maternal deaths, hiding the infant deaths, etc. But it doesn't support the entire DHIS2 program rule engine. We are looking into that in the future. This depends a little bit on resources, but that is something we know is a requested feature, something that would be useful for many of you, and we're hoping it's something we can implement in the near future. Right now, it's not supported, but it is something we hope to support relatively soon if we can implement that. Yeah, we know that is an issue for some of you, so I apologize that it's not there right now, but it is something we are looking into for sure. Okay, yes, Mohammed, please go ahead.
Hello,
Yes,
good
hello.
afternoon. Are you hearing me well?
Yes.
Thank you so much. First of all, thank you so much for all your this comprehensive webinar for the ICD-10, 11. Sorry, I think this second meeting regarding for the International and Statistic Classification of Disease 11. I was attended that meeting. Some collaborated with WHO and Africa Union in Uganda last year regarding for the International Classification of Disease 11. My question is, what are the versions? Which is the versions that the development currently the ICD-10, ICD-11s, and can we use the Android version also to collect that for the certificate, death certificate? And the second question regarding for the Anaconda analysis, can we do the analysis through the DHIS directly, not by the support the Excel sheet to put in the Anaconda and to make the diagram, to make the analysis and something like that? Thank you so much.
Thanks. So yeah, so right now, the Android app doesn't support the full kind of access to the dictionary and the coding tools and the rule engine underlying using that's within the the kind of app itself, the kind of forming the basis of the app itself. In the future, we might look into, we have these capture plugins. This is a relatively new development. But even then, that would be for the capture app to start. That would be our first target. The Android app is maybe something we look at, but it's realistically not on our roadmap for some time. I think we're not necessarily sure if we'd have to look into it a little bit more if we're supporting if the Android app can even support what we've done at the moment. So you can enter the data, but you would not have access to the ICD-11 dictionary, the underlying rule engine, etc. So that is a bit of a challenge if Android was to be used to capture this data at the moment, though we will have to look into it a little bit more. I apologize, I don't have a better response, but I can say that at the moment, it's not really on our immediate roadmap. On the second question here for Anacod, right now, we don't have any plans to have the full detailed Anacod analysis built into DHIS2. That is a very well utilized tool for a number of years. Even before ICD-11, there was the ICD-10 version, a lot of research and development behind it. We don't really foresee the need to implement all of that functionality directly inside of DHIS2, and we can integrate with it quite easily, as I've demonstrated. You are able to create a number of the outputs that are in Anacod directly in DHIS2. So if you want to recreate those in DHIS2, you can, and then put those on a dashboard. But the full analysis that's kind of built in there, that's not immediately on our next steps, I would think, at the moment. Maybe that's not the answer you would like, unfortunately, but yeah, that's where we are right now with the development, where we're just continuing to support the use of Anacod. We think it's a great tool. It has a lot of excellent documentation and resources. And yeah, we just think that's the right place for it at the moment. Okay, so I'm going to hand it over to Ty. I'm going to look through the questions there. If there are others, I didn't really address that many, I suppose. So I will try to answer any as well while Ty's demonstrating the installation of the application, and we'll go from there. Please also, there's the community post. If there are questions that we aren't able to address within the time frame here, please post your questions there. I'll find that post, I'll link it, and then you can add questions. That way we can have some conversations after the fact. I know there's a lot of questions about how this works, and maybe even more so after Ty does his presentation. So we're happy to kind of support you in that after this webinar as well. So I'm going to stop sharing my screen. I'm going to hand it over to Ty, and I'll look through the questions and I'll try to answer any that are outstanding as well. Thank you.
Yep. Hello, everyone. My name is Thái. I'm one of the main developer of the ICD-11 Corp desk, working with HIP Center and HIP Vietnam on its development and implementation. So now I will go quickly how to download and install the app. Over here I have the instance that haven't installed the app yet, so I will use this instance to demo how to install the app. So in order to download the app, you can use the Destro app hub. In order to go to access this to the app hub, we go to the app management, and it have the app hub over here, and just simply search for the ICD-11 Corp desk. And here you can see we can easily install the app by click on this button. Below here we have multiple version of the app, but I recommend using the latest one for the new updates and the bug fix. With this button install, it's use the latest version. So if you don't care much about the version, just use the main install over here. Click install, so the app will be added into the instance, and you can see it in the customer over here, or you can view it in the menu. Just refresh the page, and you can see it in the menu of the dashboard. Now I'm open the app. This is the installation page where we need to set up the app configuration, and we must complete this process to access all the modules and see them in the app menu. If the installation is not finished, the save page will be every time you open the app, and once the installation is complete, this page will no longer be installed. This installation process ensures that all necessary metadata for the corporate tracker program is properly mapped and imported. And in the first step, we need to choose between the default installation or custom installation. Both options help us to set up the configuration, including assigning opinion or setting the settings for the corporate program. The key difference between the default and installation and custom installation is the default one is import all metadata from the app resource. But for the custom installation, it's also import the metadata for the program, except the socket entity attribute and socket entity type, because these attributes are general information such as first name, last name, and gender, which can be used in other program. So the app can review the attributes. So we have to manually map them with the required field in the app. Um, uh, um, for I'm recommend to using the custom installation if your instance already implement the tracker for any help program. For example, I click on the default installation. You can see it skip the step for set up the attribute and the form, because it will automatically get all the metadata from the app resource for attribute and for data element in the form. So now let's go back and select the custom installation. In the custom installation, we have to map the attribute for the required field in the form. So that's why it's all the attribute, and you have to map on the required field in the form with the attribute you have in your instance. Um, the drop down list here will list all the attribute you have in the instance, and what you have to do is just pick one attribute in order to map it with the required attribute in the form. For the full name, we have the name option, because some country they don't collect the name in the certificate, but some country they just have the full name, but some they have full first name, middle name, and last name. So that's why here we have the option for how to set up the name in the form. For example, if you choose the first name and last name, it will disable the middle name drop down list here. And what you do is just pick attribute for the first name and last name. For that bus, that's the bus is estimated the age, address, and for gender. The female option, it is used for trigger the rule to hide or show the method node session in the data entry form. So the drop down list, it will list all the option of the option set being used in the set attribute. Like it will get on the option from the set attribute used list for the set attribute over here. And what you have to do is select the right option value for female. And You can also add other attribute. It's not required in the form. So if you have some other attribute like national ID or passport number, you need to collect. If you want to collect this attribute, so just you feel free to add it into the form. But now I don't have anything. I just go next to the form. In the form, yeah, you can see he on the default section in the form. It's based on the medical metadata over here. Like we have the complex A, B, C, and D, and we have the surgery manner of that. Yeah, it's the on the default section in the form, and you can do like you cannot update or remove the default section. What you can do here, you can add more other section into the form if you wish to collect other information. Just click on add in order to customize your other section over here. The next step is to assign the organist for the program. It's like here you define which organist will be used for collect the complex data. Um, for assign user, this step is for setting up the sharing for program with user group in the instance. For example, here for admin group, I choose admin. For capture, I choose admin and capture. For view, I choose admin and view data. There are three group: admin, capture, and view group. It's representing for different level of access. For example, in the admin group, the user in the user group set as full access to the programming directory and can access all the module in the app. So it means all the user in this group can view all the module in the menu over here. And also have the full access into the in the directory for the program. It's same for the capture group. The user in this group only can see the data entry. And for the view group, user in this group can only view the dashboard in Anacos. This review step is to review on the reverse configuration and check if you missing any setting. So you can go back to the step to accept the setting. When you confirm everything is okay, you can click on install, and it will start the importing process like I mentioned in the beginning. Like this process is to import all the metadata. Yeah. Let's wait. For if the installation is finished, it will well, yeah, it's finished. It will show the finish button, and you can click on finish, and it's immediately show the administration module. And in this in the administration module, you can what you can do is, if you have attribute other attribute you wish to add into the form, you can do it over here. But you cannot change the default the default attribute over here. One thing the app allow you to setting up the certificate. This is the default certificate that the app provide to you. And what you can do is you can edit the title and or upload the logo over here. You can also add more data element or attribute into the body or footer, and you feel free to update the order by using the order over here. Like I move it down more depth of depth down, so you can feel free to uh, set up your default certificate over here. In Sky, if you have the template for certificate, you can use it. You can upload the template in report, and then use it in the custom certificate. And what you can do, you can add the attribute and the data element directly into the template, and each template will be shown on the data entry. Yeah. The last thing I want to say is if you have any issue with implementation or technical, you can contact me or Surajit and his Vietnam team for your issue. Yeah, that's all.
Okay, thanks, Ty. So I just I've been answering some questions here. So just before we just wanted to discuss a bit about the analysis. I think this is also a good question to address. For those of you concerned about making your own dashboards, the app itself takes all the causes of death and it's going to automatically group them in two ways. One is the ICD-11 chapter. Okay. This is the chapters that are used when you select your causes of death. It's going to automatically group those codes via the chapters. It's also going to do this via the cause group. So rather than having to manually generate a bunch of indicators for the ICD-11 codes, if you are interested in performing additional analysis on any of the other codes or your underlying cause of death, I would suggest that you use either the chapter or the cause group in order to make your outputs. So this output that I'm showing you that I showed in the demo really briefly, this is using the ICD-11 chapters. I didn't have to create extra indicators, etc. It took all the ICD-11 codes and automatically classified them according to these chapters for me. Okay, so I can utilize what's built in order to create some analysis for my own purposes. Of course, if you add additional sections, or if you want to analyze some of the other details, maybe the maternal health section or the surgical details, etc., then you might have to create some indicators to coincide with those additional sections. But just keep in mind, regarding the underlying causes of death or some of the other causes of death, they are grouped together already for you. We know there's a lot of causes of death, of course, and if you take all the codes and try to group them yourself, it's going to be difficult. But WHO, of course, provides a lot of guidance on how they're grouped together already. So we're just using that to create these groupings for analysis as well. Okay, so hopefully that assists you if you're thinking about how can I create my own dashboard inside of DHIS2. You can use these built-in classification systems in order to generate various outputs for you to utilize as well. Okay, another thing I wanted to address was the ICD-11 version that is being used in the application itself. So we are accessing the ICD-11, it's called the DORIS service, directly via WHO. And WHO provides this service. They are updating this service. They have been very open about what they're doing with this service. They have a lot of documentation, a lot of great insights and information that's available. So because we are accessing the service directly provided by WHO, this means that they release information on the updates to the ICD-11 version, as well as information on the ICD-11 API. Okay, so you can see right now, this is updated with the latest 2025 release. The ICD-11 API version is using version 2.5. Now, WHO will update this service, and the app is directly accessing this service. So based upon what WHO provides, basically, or updates, that's the version that we're utilizing in the app, as we're just accessing the service that they're providing. So we're not maintaining this service on our side. We're accessing a service maintained by WHO. There's a lot of great documentation that they have regarding this service, how it's utilized. You can run test cases. They offer all kinds of, for technical folks, you can deploy it locally and test it. etc. Okay, so I just wanted to clarify those two items as well as I was looking through the chat. Okay, so I wanted to discuss a little bit on our future plans as well, as there have been some questions about that, both in the chat as well as the people that asked some questions after or later on. And we'll open it up at the end. At the end of this, Ty and I are happy to stay on if you do have some questions, if you want to ask those in person, even though I know we might be a little over time for the webinar itself. But we're happy to stay on and answer some questions if you have them. Okay. So regarding future plans, so right now, so we mentioned first the ICD-11 plugin for the Capture app. So right now, what we've built is a custom application on top of DHIS2. You access that application, you access the ICD-11 service and the rule engine using that application, but you're not using the built-in DHIS2 Capture app, for example. We are thinking about if we can have a plugin of some kind that you could place in the Capture app that would allow you to access the ICD-11 browser, that would allow you to use the digital mortality rule engine. We're not quite sure exactly how it would work because, as I mentioned, you need all the fields in the form in order to properly get the underlying cause of death returned to you. And if you're leaving it open for people in Tracker to build their own programs, they could realistically have any set of fields in there. They might not have all the necessary fields. So we're thinking about the best way to do this, but we haven't quite come up with a solution yet. The other thing that we're thinking about, and I should add, none of this is promised at this point in time. It really depends on the situation we get in terms of resources, but we'll have to see how things go. But we are looking at adding or testing new workflows. I saw a couple questions in the chat about this. Basically, the workflow we're supporting is that the certificate is filled in, right? That's the one that's available now, or you might have to come back to the certificate later on, multiple pieces, but it's not really supported in the most intuitive way. We understand there are other workflows. I've just outlined one here. Maybe you have someone just filling in part of the certificate, the enrollment details, the frame A and B plain text, so without the codes, you're not actually coding the certificate. And then maybe you're coding the certificate, someone else is doing that at a later time. And then you're selecting the underlying cause of death. That's also done by somebody else who can verify this. Now, this might help also for Android implementations, as maybe the coding would be done at another point in time and on the web. That way, you don't have to worry about that on the Android device. So we know that there are other workflows out there that exist, and we don't yet support every potential workflow. But we are looking into this a little bit more. We're hoping it's something we can support in the future. So we are aware of that, and we are hoping that we can address that in the future. Okay. The other thing that I mentioned, just to reiterate, is the program rule engine. We know we don't support that yet. That's also something we're considering for the future. Okay. In terms of feedback or accessing the app or utilizing the app, so we have an ICD-11 demo. It's a public demo. Anybody can access this. You can test the app there. You can walk through your various workflows. You can try your own certificates, for example, and see if you end up with the right cause of death. You can make sure it's working based on the standards you've set in your own setting. You can also download the application and you can test it on your own instance. And there's a couple ways to do that. Now, I've given some contact details. Ty gave some details in his presentation. We will share all the presentations with you, so you can contact us if you have questions, okay? Feel free to provide us with feedback. We're happy to take that feedback and kind of go from there. The app is also available on the DHIS2 App Hub, okay? And what I would say, it's available for testing, but we're planning the full production release in about 2 weeks' time, okay? And we will let you guys know. We'll make an announcement on the community of practice. We'll send out, have a notification on social media channels, etc., to let you know that the production version is available, okay? But if you want to have a look at this now, you can. It's available both in the demo link that we provided on this page. You can download it from there, and you can also download it from the DHIS2 App Hub. Now, when you're testing it, please do this on a development system of some kind. Especially if you're testing it, right? If you really plan to roll it out, okay, that's maybe a different set of circumstances. But if you're just doing testing, please don't do that on your production. Please do it on a development system of some kind. Okay, we will release the production ready version, but even that version, still test it before you deploy it, just like everything else. Okay, and we will let you know when that's available, and that should be done soon. In terms of resources, so that was a question also asked earlier. We do have the demo instance that you can use. You can download the app itself. We now also have various documentation that we've published in the DHIS2 documentation page. Okay, so we have a user manual. This goes in through a lot of detail for the user-facing features, everything that I talked about, how to use data entry, how to browse the dictionary, how to select your underlying cause of death, assign the time frames, use the manual selection, review the output, fix common errors or mistakes or warnings, etc. Okay, so this is all available for you to utilize if you're thinking of looking at this more seriously and want to deploy this. We do have a user manual that goes into a lot of detail for using all of the different functionality within the app itself, the certificate, translations, all that stuff. Okay. We also have an installation manual, and this covers what Ty discussed briefly, but in more detail, of course. And it goes over the different types of installation. If you need to merge this with an existing system, if you're starting from scratch on a new system, the different user roles and permissions that you can provide for the people, accessing the app and making sure that they're kind of seeing what they're supposed to. Okay, so we do have these resources now. They were just published, I think, yesterday. So a couple days ago. So they're newly available for you. They're linked in this presentation. You can access those. You can use those. If you're doing some testing, it might be useful to look at the user guide or the installation guide so you can follow those steps and make sure you're not missing anything before you reach out for support or assistance. Okay. I've also linked here to Anacod. This is the tool we showed for the analysis. If you're not familiar with that, there's a lot of good resources there that can be utilized to analyze your cause of death data, which is kind of the whole purpose of this, I think. And then the app on the App Hub itself. So if you want to access the app and download that and test it on your own system, there is a link here as well. All right. So I think we'll end the session here for now. Like I said, if there are any questions, anyone wants to stick around and ask Ty and I some questions, we can do that. If not, we'll close the webinar, but Ty and I will stick around for a couple minutes just to make sure that there aren't any outstanding questions. A link to the Community of Practice post has been posted in the chat as well. So please, if there are questions that you want to ask after the fact, you can ask them there. If you're testing something and you don't want to email us, you can also post some questions there. Just try to tag us maybe so we can get a notification that you're asking us a question. Yeah, you can also email us using the emails here. I also shared some emails for you as well. Okay, and we're happy to follow up via that mechanism as well. So I'd like to thank everyone for their participation, for their time today, for their active engagement and their questions. Like I said, Ty and I will stick around a little longer if there are any questions for us. You didn't get to ask any questions about the install, so if you have questions about that, you can feel free to do so now. And then, like I said, you can post more questions on the community. You can email us as well, and we're happy to take questions that way as well. So thank you, everyone. If you don't have any questions, please feel free to leave. If you do have some questions, please feel free to stick around and we'll try to address those. Thank you very much, everyone. So I guess you can stop the recording, Simone.
Yeah, it stopped already.
Oh, okay. Oh, it's showing me it's